Hello, wonderful people. Welcome to my channel. So it's been almost 2 years since I became a registered psychiatric nurse in Ireland, and I always wanted to do a video on how I actually went through my adaptation process and to kind of share some tips, okay, that really helped me during my adaptation process, because I know it's going to go a long way for most overseas nurses looking forward to also undergo adaptation. Recently, we've had a lot of bad news, people feeling adaptation, and I know it's been very stressful, and I believe that me doing this video will also go a long way to also help an overseas nurse coming into Ireland to also undergo this process. Okay, so first and foremost, let's look at what adaptation is. So after you've registered with Nurse and Midwifery Board of Ireland, you get to receive a decision from them. So the decision actually comes in three forms. It's either an acceptance, okay, where you get to work in Ireland straight away without having to go through any adaptation or any RCSI, any examination basically, or when you receive a decision letter from NMBI, which is going to state that there is a bit of shortfall in your training. So for you to make up for that, you have to complete aptitude tests, which is just like, you know, the UK, you having to do the CBT and also the OSCE, or an adaptation. So an adaptation is when you are given a period of 6 to 12 weeks for you to work in a clinical setting for under the supervision of your supervisor. So basically that's it for the decision 2. And the third one is going to be a refusal, which is you know, the chance of you people receiving refusal is very limited, okay, because a lot of people now understand the process. Okay, so for me, I was asked to come and complete an adaptation. So it is left with your hospital to choose whether you do the exams, which is aptitude test, or the adaptation. So I was asked to come and complete an adaptation. So with the adaptation, you have a period of 6 to 12 weeks for you to complete it, okay? And then you work under a clinical supervision. So you are given preceptors that are going to supervise you and also, you know, take you through the whole process, and then see at the end of the given weeks, they are going to make a decision to say whether you are competent or you are not competent. Okay, so I was very fortunate enough to have 2 preceptors. So me doing this video too, I want to say a very big thank you to my 2 preceptors, my wonderful preceptors, Aoife McLaughlin and Sam Keliso Moyo. Yes, I had 2 preceptors, and they were so wonderful. They were like sisters, they were my seniors when they had to be, and also they were there for me in so many ways. So I want to say a very big thank you to Aoife, my Irish preceptor and now a sister as well, and my Sam Keliso Moyo, also my preceptor and also a big sister. I really appreciate you guys so much. Thank you for being there for me. Thank you for holding my hand and teaching me so much that I had to know and making me, you know, the Irishness that I am today. I'm really grateful. I appreciate it. So let's go straight into what adaptation is, some of the things that I actually held strongly and that actually got me through this process. Okay, so we're looking at some of the struggles and some of the things to expect, and also we're going to have a midwife also sharing a bit of advice to all the midwife, and also an RGN also giving out an advice to all my RGNs, just to be fair to everyone. So stay tuned. So during your adaptation, there are 6 competencies that your preceptor is going to assess you on. So let's have a look at it. So the first one is your professional values and conduct. The second one is your nursing practice and clinical decision making. The third one is your knowledge and cognitive competence, okay? And then the fourth one is communication and interpersonal skills. The 5th one is your management and team competence, and then the last one is your leadership and professional scholarship competence. Okay, so these are the 6 main domains that your preceptor is actually going to assess you on. So during adaptation, you're going to have 3 meetings. You have the initial meeting, the intermediate meeting, and also the final meeting. So with the initial meeting, that's when there is a bit of like collaboration between yourself and then your preceptor, where you sit down to identify some shortfalls in your trainings, okay, and then you are able to set your objectives, okay, and then your goals for that adaptation, okay. So you are able to identify things that you have to learn. You have to your preceptor is going to tell you some things that you need to know. Let's say how to complete admission, discharge, maybe self medications, you know, and all of that, a whole lot of things. So you are going to identify some objectives that you have to complete. And then the intermediate meeting looks at how far you've been able to come, your strength, your shortfalls, based on your initial meeting, the objectives that you were able to set with your preceptor. So your preceptor is going to look at all of that, how you've been able to come so far, okay, with your adaptation, and some of the challenges that you've gone through, how you can improve upon yourself and all of that. So the first meeting is usually in the first week, the second meeting usually in the third week, okay, and then you have the final meeting, which is either the last week or the dependent on your preceptor, okay. So that's when your preceptor is going to look at your performance so far and to either mark you as competent or not competent. If you are competent, then congratulations, like myself, you get to become an Irish nurse. If not, you are not competent, they are going to state the reason why you are not competent, and then they are, if dependent on them, they can also request for an extension of your adaptation process. Now let's go straight into the adaptation process. Let's look at some tips that were really useful to me during my adaptation process. Okay, so coming into a foreign setting, right from Africa then to an European country to work as a nurse was really difficult because you're not used to their system, you're not used to their culture and all of that. So it's expected that you're going to be anxious. I was really anxious. The anxiety level was up here, way above actually, but I was so confident. Yes, you are still going to have the anxiety, the turn of the stomach and all of that, but I told myself that I'm here to do this. So even though I was really anxious, I always held my head high. I was confident. I didn't really allow the anxiety to take the most of me. Okay, so I know you guys, everybody going through adaptation has their own challenges. The anxiety is going to be there, but please, you have to be confident despite that, and still try and prove yourself, know your stuff, and then continue to prove yourself. Okay, and then the next thing is that you have to learn to unlearn. Yes, I know you have 10 years of experience from home, 15 years of experience from home, even 20 years. We appreciate your experience. Ireland really does appreciate your experience, but you have to learn the new stuff, to unlearn some of the old things that we are used to. I know from where I come from, we used to do a lot of improvise, like improvisation. You always have to improvise. They do this and do that. It might not work like that over here. So if you're here and then you are going to undergo adaptation, try as much as possible to learn the ways things are being done in hospitals here in Ireland. Okay, so if possible, try to adapt, okay, and then ask a lot of questions just to make sure that you are doing things the way it's supposed to be done. Don't use your own judgment to just carry out procedures or just take decisions without the knowledge of your preceptors or your supervisors on duty that day. So you should be able to unlearn some stuff that is not accepted, and also pick up new skills, okay, that is accepted in the Irish setting. So the third thing I'll be talking about is having a good communication and also interpersonal skills, because you're going to communicate with let's say your patients, so you should be able to communicate very effectively, be very humble, be nice, have very good interpersonal skills, relationship with your preceptors, your patients as well is very, very important. Try as much as possible to talk in a very clear manner. Okay, sometimes it's very difficult understanding us coming from Africa and all of Asia or wherever. Okay, but I believe that you being able to calm down when you're talking and then trying to explain yourself is very good, and also being nice to people. Okay, it might not be in you might not be an extrovert person, you might be an introvert person, but the purpose of you working in a clinical setting, you should be able to make your patient feel comfortable around you. Okay, and then be very nice, be nice to your patient, because that should be your priority. The next thing I'm also going to talk about is embracing their culture. I know culture shock is a very huge subject and topic for most overseas nurses coming into abroad to work. Okay, so there are a lot of things that you are going to face when it comes to communication, when it comes to working in their clinical setting. Some procedures that you have to learn, even their food, their dressing, a whole lot. Okay, I quite remember I was at the MDT meeting, and then I actually asked the medical supervisor to come down because it's my first time at the meeting, and then after the meeting my preceptors were like, like, oh, you don't tell us to calm down in Ireland, you know. You can say this in a better way, okay? So you don't say calm down, you just have to say, excuse me, this is my first time, so I appreciate it if I'm giving a consideration, you know, to express myself or something, but you don't tell Irish people to calm down. It's not accepted. For us in Ghana, saying calm down is it's normal. We tell ourselves all the time, but it sounds offensive, okay, here. So it's something I also got to learn. And then I'm always conscious not to tell a patient to calm down when they are distressed, being like a psychiatric nurse, but putting it in a better way, okay, telling them that I know they are going through a difficult time, and I also appreciate their circumstance or the distressing circumstance that they are going through, and they should know that I'm here to offer support and all of that, instead of using the short word calm down. So these are some of the things that you should know. And when it comes to the midwives and also to the registered general nurses as well, it should be something that you should be able to accept their culture, how to communicate with them, and how to perform procedures and all of that. So be open-minded and also be ready to embrace new stuff. It's very important. The next thing I'm also going to talk about is the fact that you have to be humble and then don't undermine anyone. I know that sometimes when we come from our home country with a lot of experience, we expect people with the same years of experience or more than us to kind of take us through, you know, their clinical ways, okay, or to kind of preceptor us. But we should always remember that it doesn't work like that. My preceptor, if I was just 6 months out of school, but she still had to, you know, take me through and so guide me through their system. I never for once thought that because she was just out of school for 6 months, so she was unqualified to be my preceptor. I always respected her. I humbled myself when I have to be. And I say humble yourself, it doesn't mean you have to, you know, be stupid. Sorry if I have to say this, but you should be able to humble yourself, accept new things, be open-minded, and also treat everyone fairly, okay? We have to respect others for you to also be equally respected. So don't undermine anyone during your clinical examination or throughout even your practice in Ireland. Try to treat everyone with respect, and then you're also going to get the same thing. And one thing that I always told myself is that bad days are inevitable, okay? So there's an adage that goes that when life gives you lemon, makes lemonade out of it. There are bad times that you are going to face, okay? There are sometimes I had to run to the washroom and cry a bit, you know, a lot of emotions running through, you know, back and forth. Did I really make the good decision? Why would I really leave my family? I miss my kids. A whole lot of things, you know, encountering patients that will not really be pleasant to you. There are some times that you're going to make mistakes and all of that, but you have to remember that you are here for a purpose, okay? And then try as much as possible. If it was a mistake or something that really got to you, try to improve yourself. Don't say that because I did this procedure it didn't really go well, or I actually made this mistake, so I'll kind of restrict myself or refrain myself from actually carrying this procedure again. No, you have to challenge yourself. Know that you are here not to fail, but to actually pass, okay? And you've actually done so much and gone through a long process to finally get to Ireland. So when you're having a bad day, just embrace it. But the next day, try to put on a beautiful coat, you know, and then try your best and make sure that that same thing does not happen again. If possible, ask your preceptor the best way you are able to carry out a procedure that you did not really do well, okay? Be open-minded and then be ready to accept your faults, and then try as much as possible to do your best next time. It's very important. Now let's go into the adaptation process. So I had to do orientation for 2 weeks, and then I began my adaptation on the 3rd week. Then I was signed off after my 6th week. So in all, it was 8 weeks for me. Yeah. So it's all dependent on your preceptor and also the protocol of the hospital. Some hospitals will tell you you have to complete the whole 12 weeks, which is very popular with the midwife. So please, if your hospital tells you that you have to complete the whole 12 weeks, not because they don't trust you, but most often is the protocol of the hospital. However, NMBI still gives you a period of 6 to 12 weeks for you to complete your adaptation. So that is still fine. So talking about the adaptation process for me from the my third week, okay, it was a bit challenging because you are now on the on the world. You are now expected to start, practicing and all of that. There are a lot of things that I actually did that really helped me in my first few weeks. I'll say my first 2 weeks, I was like, okay, I'm going to make sure that I get to know all the patients. Okay, so where I actually worked, we had 21 patients, and it was an acute unit. I quite remember when I went to the nurse station, there was a very big board with initials of residents. I was like, how am I going to learn all of this? Okay, so there was a bit of panic, but as I said earlier on, you still have to be confident and still be a go-getter. Okay, so you having at least a pocket book and also a pen is very important to note like some significant things that you have to go over, and also to make sure that you achieve. Okay, so I had sets of goals at that particular point. So I was always saying that during the first few weeks, if possible, try and then read more about the policies of the hospital. Okay, so that at least you know that you are working within the policy of that hospital. Get yourself abreast with their different types of policies. So I was able to do that, like learn most of their policies, read through, and also at least get to read each and every patient. Okay, so that's also a very big thing for you to do. Try as much as possible to read the case notes of each and every patient, know their history, what actually brought them on board. Those few things are very important, so that at least when the medical team also comes around, or the treating team also comes around, you are also able to understand the patient's history, and also, if possible, able to adapt or also contribute, which is very important. So apart from that, I did a lot of observation in the first few weeks. I tried as much as possible to observe some of the procedures that were done, even medication. I did a lot of observation. Sometimes you are going to be asked by some of the nurses, because they know that you have a lot of experience, so they try as much as possible not to offend you, and they'll tell you that, oh, could you do this because you have so much years of experience? You just tell them, no, I know I'm in a different setting. I do appreciate the fact that you kind of acknowledge that I have experience, but I still want to observe to make sure that I do the right thing at that moment. Okay, so it's no big deal when you tell them that you want to learn. Okay, just tell them you want to observe and then learn during those few weeks, so that when you are also given opportunity to do it, you do it with so much confidence. Okay, so with that being said, I'll just try to summarize it. The first and foremost is that you try as much as possible to get yourself abreast with the policies of the units or of the hospital. Also try to know your patients, very important, and also try to do a lot of observation during the first few weeks. Have a pen and a paper or a booklet with you, and then write some important diagnosis, okay, and some procedures that you have to read on when you get back home. It's very important. So going forward, you should be able to know specific procedures or things that are being done on specific days. If you're on the theater, you should know all of that. If you're in a psychiatric setting or the midwifery setting, I know that the hospital setting is very dynamic. We don't really have specific things being done on specific days, but some units like the psychiatric units do have like days for MDT meeting, which is a multidisciplinary meeting, days that the doctors will come around for review. You should be able to know that and then plan ahead of time. Okay, make sure that when you come in, you read notes from the night staff, at least to know what really happened or transpired during the night, so that in case you are being approached by any doctor and then you are being asked about how a patient is faring, you are able to say something, okay, not just say something but relevant information to the treating team. So it's very, very important. Also, I'll say that you should be able to take up new tasks. Okay, you've been on the ward for some few weeks. When you're asked to do some stuff, don't say that, oh, I'm still learning, can you still do it? No, it doesn't work like that. As I've been on the ward for some few weeks, you should be able to take up new tasks. You should be able to even, suggest that, oh, would you want me to do this? I can do this. Can you leave this to me? I can remember after like 2 weeks, we're handing over at our unit, and then my preceptors were very busy, trying to close up a lot of things that that we did, and then the night staff were actually in waiting to take up the units. So I actually suggested that, oh, do you mind if I hand over? And they were like, yes, we're actually waiting to see if you suggest to hand over. So you see, sometimes they are actually putting you to the test in so many ways. And remember that adaptation is very objective. It's very objective. So there are a lot of observation going on. You are being assessed, how you carry yourself, how you challenge yourself, and all of that. And I was glad that I was able to like hand over, and I did it. Yes, the anxiety is going to be there, but you still have to do it like professionally, and then, you know, make sure that you use professional tone and in language when you're also dealing with your colleagues as well. So take up new tasks, be willing to challenge yourself, and then do new stuff is very important. So during your last few weeks, okay, you are done with your first meeting, your second meeting, you should be like a pro of the world, okay? But it still doesn't mean that you should do things without the supervision of staff on duty, okay? So at this time, you should be able to do like carry out procedures without being told, okay? If you know that it's time for medication rounds, you should know what to do at a particular time, okay? You don't have to, and please don't be complacent. Don't say that, oh, I know this, so okay, I'm not ready to learn more, I'm okay, I think I'm okay. No, it doesn't work like that. Always be open-minded and to be ready to learn every day, okay? At the medical ward or at the medical setting, at the healthcare setting, every day is a new opportunity for you to learn, okay? So in as much as trying your best to learn each and every day, also be able to now carry out a lot of procedures by yourself, do things you know, at the right time, okay, which is very important. Carry out procedures, self medications, and then please don't run away from procedures, okay? Don't say that, okay, I like doing this and I hate doing this, so okay, I'll try to stick to the things that I'm used to or I really like. No, challenge yourself to still do what you are not comfortable with, because when you are done with the adaptation, then finally you have your PIN. Remember that you are not going to like say that, okay, can you do this? You are still open to whatever procedure you have to complete. So challenge yourself to master the procedures, okay, that you are not comfortable with during your last few weeks, okay? And then if you need a bit of touch up or a bit of assistance, always reach out to the staff that you're on duty with or your preceptors to make sure that you master that particular procedure or process that you are not comfortable with, okay? And then please again, if you, just to add that before I forget, an instance where you did not understand anything, just ask any staff to repeat themselves. Just something that's coming through right now before I forget. Yes, so if someone says something or a patient requests for anything and then you don't understand, because obviously we are going to have communication challenges, okay, be ready to tell the patients or be ready to tell the staff that, can you please repeat yourself? Do you mind repeating yourself? It's very, very important, okay? So that should be within the last few weeks for you. You should be able to carry out procedures and all of that, you know, not independently under supervision anyway, but without being told. You should be confident, okay? And also, I just want to add up that during adaptation, it's easy for you to fail, okay? When you make a mistake and then you try to conceal it, okay? Don't try to conceal any mistake at all that you do, because remember, you are dealing with life, and life is precious, okay? So an instance where you make a medication error, don't try to hide it, or you find out that a patient has had a fall. Such instances, you don't have to keep quiet. You have to report such case, even all cases, okay? So it's very important. And then make sure that you when you are carrying out procedures, you carry out procedures effectively so that it does not become life-threatening to patients. Like example, if you are a theater nurse, don't be leaving dentures in the mouth of patients whilst you are preparing them to the theater, okay? So always make sure that you check every procedure that you do to make sure that you don't leave out mistakes that is going to cost you and then the hospital, okay? So these things I believe are very important, and then we should always be mindful of them. So I just like to mention a few things that were like a huge challenge to me, okay, during my adaptation. So during my adaptation, I think answering of phone calls at the unit was like a big hell for me. I always try to run away from that. Yeah, I'm not going to talk about all of this and not talk about my challenges, okay? But I still stood up for that and then tried as much as possible to become used to it, because sometimes, you know, when their accent is very difficult to understand, okay? They talk fast. I know I talk really fast, but they do also talk fast, so it's very difficult to understand them. So I always run away from, you know, picking up calls on the unit. But please, you saw, how would you know if you keep running, okay? So I actually challenged myself to keep like doing that. So when anytime there are phone calls, I'll be like, okay, now can I answer, just to kind of build myself. Okay. And then secondly, I say note writing. Okay, you know, we are used to a particular system or a particular way of writing our notes back home. So trying to like learn how to write their notes was like a big help, because how to express myself in their way, in a way that they would understand. Okay, writing was a very big challenge for me, but with the help of my preceptors, they made the whole thing very easy. Okay, so you should be able to like embrace change and then try to use a professional tone when you are writing your notes. Okay, like make sure that at least if you're a psychiatric nurse, I'll talk in that aspect, you should be able to capture like the mental state of the patient. You should be able to capture the nutrition of the patient, that the patient was compliant with medication, the vital signs. You know, there are some few things that you should be able to make sure that they are involved in your note writing. Okay, so apart from that, I'll say that the next thing that was also a challenge for me was facilitating the multidisciplinary meeting. Okay, me being, well, it was like, it's a new thing. It wasn't a new thing, but it was like a big challenge. Okay, you having the medical team around, you having the psychology team around, the speech and language therapist around, you know, and then having the patients and all of that was a big deal. But I challenged myself at the last few weeks, and then I actually facilitated this meeting, organized family meetings and all of that, just to make sure that I was very confident before I was signed off through my adaptation. So these were a few things that were a bit of challenge, but through the help of my preceptors, okay, I was able to overcome them. So just continue to challenge yourself at places that you are not comfortable. Okay, you should always not be at your comfort zone. Challenge yourself to do your best. Okay guys, so I'm actually going to end today's video at this point. Okay, just to record another video for my midwives and also my registered nurses. Okay, so just as I actually promised you guys, I'm going to have a midwife from Galway University Hospital and also a registered nurse from St. James Hospital, and they can also share their input and also, you know, a bit, just in case I left something out, you understand? Yes, so please remember to watch the part 2 as well. I'll also be dropping the part 2 immediately I drop this video as well. Thank you all so much for always coming through and always supporting my channel as usual. See you all soon at the part 2 of this video. Bye.